We decided that we didn't want to just provide a funding stream, although funding is important, but we wanted to at least suggest how the system ought to be built, as if we were doing it from the beginning, understanding that there were existing sources of funding and a variety of different programs. What we said with the Mental Health Services Act is that every year, at least 20% of the money needs to be spent on prevention and early intervention. 5% on top of that for innovation, and then 75% for comprehensive services with a focus on what is known in the field, as you know, as wraparound, whatever it takes, without saying the money can't be used for whatever it takes, so long as somebody qualifies because they live with a serious mental illness and they're at risk. The Mental Health Services Act will help provide the funding. And so the result has been a number of signature prevention and early intervention initiatives throughout the state, including early psychosis identification and intervention for young people, for teenagers, which I know you have championed as well. And our subsequent bill provided a unique way to raise private dollars to match public resources to be able to do more in that area. But the idea is to focus as much on prevention, early intervention as possible. And, you know, Rusty, who was a great leader who died from ALS just a couple of years ago, we always remember him and his contribution. He was fond of saying, you know we will really have made it, when we reverse the numbers, when we spend 80% of the money on prevention and early intervention, because we don't need more than 20% for back end, because fewer people are suffering the life altering consequences of not getting the help they need and the help they need early. Mm-hmm. And so we've got a lot of work to do. Proud of the work, but this is a lifelong, this is lifetime work, because the system still is not nearly as responsive enough to people as it needs to be.